Longing is a deep yearning for what is lost or unobtainable, and amazingly holds a transformative powers when intertwined with self-care and spirituality. When we set boundaries and practicing self-compassion, we navigate our longings while preserving our strength and authenticity. Embracing compassion opens pathways to healing and connections, helping us to navigate the complexities of relationships. Acknowledging and honoring our longings, we transform grief into strength and wisdom, fostering a richer, more interconnected experience of life where everyone feels valued and cherished.
I lived in a town that had train tracks, and unfortunately, we had a number of young people that would want to die by suicide on the tracks. We would get called into that to really do some cleanup and trying to be reverent in the way that we did that. But it was gruesome. And there's things now like I can't watch horror movies or anything that has a lot of physical violence in it, especially we see a lot of gunshot victims in our trauma bay. And I'm like, no, I can't do it.
In today's episode, our guest delves into the profound journey of spiritual awakening and healing, not only her own life, but also those she works with. Thank you for joining with us. You're listening to the Urban Grief Shamans, and I'm your host, John Moyer.
As an EMT, it was in the backs of the ambulances. In addition to doing wound care and giving oxygen and providing safe transport, holding people's hands who were scared, bearing witness to the suffering. They'd be asking deep questions. Why is this happening? Those moments of human connection and recognizing there's all sorts of ways to heal people. And that sense of spiritual healing that happened between two people led me to do the work that I do now as hospital chaplain.
Our guest is Chris Wasco, a compassionate hospital chaplain and former EMT paramedic whose spiritual journey began after an intense and emotional childhood. As Chris worked on healing, her spirit began to awaken, leading her to develop skills as a psychic medium. This transformation allowed her to connect with spirits and offer guidance, particularly to victims of narcissistic abuse. Join us as Chris shares her remarkable soulful development.
I grew up in northern New Jersey, a precocious kid. My family went to the local Presbyterian church. My mother was a nurse. She stoked that fire in me. I worked as an EMT to train for that. And it was in the backs of the ambulances. In addition to doing the minimal wound care and giving oxygen and providing safe transport, I enjoyed holding people's hands who were scared, bearing witness to the suffering. They might be asking deep questions like, why is this happening? Those moments of human connection and recognizing there's all sorts of ways to heal people. And for me, it was that sense of spiritual healing that can happen between two people led me to do the work that I do now as hospital chaplain.
Growing up, were you introduced to grief?
So I think the biggest grief that I had growing up was what I would call an intrapsychic grief, which was around a medical diagnosis that I had. So I became a patient and was in and out of hospitals myself, and then was correctly diagnosed, although it took a while, with generalized epilepsy. And so it was some of those losses around minimal things now, but to a teenager is important. Losing my hair due to the medication I was put on, losing the driver's license, losing my image of myself to be able to do the things that I wanted to do and couldn't. And really the way that it impacted my relationship with God, because I was similar to those patients in the back of the ambulance wondering, why is this happening? Feeling very much the dark night of the soul. So when I think about different types of loss, I think that was a significant one for me that helped guide me into the journey of being with other people, especially when they're diagnosed with something. A question that I love when I walk into a hospital room and people say to me, oh, I'm not spiritual, I'm not religious. That's okay. Tell me what does mean something to you. What fills up your heart, or what is weighing on your soul in this particular moment? So trying to help them identify what theologian Paul Tillich called the ultimate concern, because To me, people are spiritual even if they're not believing in God or they're not prescribing to a certain institutionalized religion. It's about identifying what we hold true to ourselves. What is it we value? And then where is the disconnect? So for me, as instance I said before, connecting with myself, connecting with others, and connecting with a sense of the sacred or the divine is important. And I find disconnect happens for people when they're not feeling connected with themselves. So maybe some of my patients are about to have surgery. They're in a lot of pain. They don't want to connect with their bodies. Their bodies have been betraying them. With community, maybe it's being in the hospital, being away from their loved ones. I was with a patient not too long ago who said, I've never not slept in the same bed as my wife for 60 years of marriage. And here I'm in the hospital and all alone. So even though it was temporary and he was going to have a good physical outcome, there's still that separation, and that does something to us. And then in terms of the divine or the sacred or God or however we may define it, for some it may be nature, it may be the universe. I think it's how we're making meaning of what we're going through. And there's times where that meaning may lead us to believe that there's a disconnect there. That it's when I'm with a patient who gets diagnosed with lung cancer and says, I never smoked a day in my life. I don't understand why this is happening for me. Then there's that disconnect as he's trying to wrestle with, this is not how I thought the universe should be ordered. So really identifying where does a person connect and where might there be that disconnection is part of the work that I do. And then to get to your other point about how to take ordinary moments and really infuse the sacred in. A lot of times my spiritual direction clients, some of whom are clergy, will feel guilty and they say, oh, I should be reading or I should be meditating for 45 minutes and adding things to their to-do list that just make them feel crummy when they don't get done. And so I encourage them to say, what are you already doing throughout your day? And how can we make that a spiritual practice? Encouraging people to think, what is it that you're already doing in your life? And almost like a sacred habit stacking, right? We don't need to necessarily create something new, but you can do whatever you're doing already with intention to really separate it out as a...
Mm-hmm. You forgot to mention chocolate in that comment about coffee.
Yes, I do think that chocolate can also be a spiritual practice for me anyway.
Mm-hmm. Well, what's the general reaction of people when you approach them about enhancing their spirituality?
I think most people are interested in it, especially those that are meeting with me for spiritual direction. So they're self-selecting, to be sure. And so it's people that are wanting to do this. A lot of the work that I do with my individual clients is around undoing some of the toxicity that has happened to them as a result of religious institutions. And so that's a lot of where I call it like a patient untangling of the ways in which they have internalized certain theological truths that may not be serving them well anymore. So it's what did they hear growing up in their families of origin, or what was being preached from, maybe they didn't go to church. Maybe it was just the TV was saying something. The ways that we may have internalized beliefs that may not be serving us anymore. And there may be some harm in those. So I think that is a lot of the work that I do that is helpful for people, but it takes a lot to analyze that and look at that and say, is this really what I believe? And I find that people are willing to do that, particularly those that are coming from a tradition where they feel like their faith doesn't fit anymore. And they're trying to find something that's more authentic to who they are and who they've become.
What is it, the similar approach or response that you get from a stranger? Like you're a hospital chaplain, so you're just given, these are the people who were brought in the hospital last night, and you want to just go see them, but you have no relationship with them.
Mm-hmm. Yeah. So oftentimes people will say, what's a chaplain? They're very confused about what I'm doing when I come in the room. And sometimes they'll think that I'm there to convert them to a specific faith tradition. I say, no, I'm not the church police. I'm not taking attendance on what your religious practices have been. I let them know I'm an extra layer of emotional and spiritual support because being hospitalized can bring up so many different emotional and spiritual experiences for individuals. And then certainly a lot of the work that I do with patients and families is not those routine, we call them routine visits, but is also the crisis visits, especially as I work in a level 1 trauma center, so that we are the point person to be the family support when there's a car accident and their loved ones are brought to a hospital and people's emotions are sky high, their anxiety, their fear, until they can have some information about what's happening. And then also there's bereavement. I can't tell you how many deathbeds I've been at in the course of my career, a fair number, and helping families in those moments to be able to say goodbye to their loved ones and being there for that really profound and beautiful and hard work to me is such a privilege.
Can you share some of your EMT experiences?
Sure. And I should clarify, I was BLS. I was never fancy enough to be ALS. Yeah. So some of the, 2 stories come to my mind from my EMS days, and then I'll switch to how I support EMS now. And I started doing that work as a teenager. And I recall my first code that I ever had was the gentleman, oh my goodness, he was probably in his mid-50s and was having some heart palpitations. And but he was joking and laughing as we loaded him into the rig. But then things went south as we were driving and had to pull over and do compressions and CPR and all of that. And he didn't make it. And I remember when we pulled up to that ambulance, we were probably 12 miles from the hospital. And when we pulled up to the hospital and his wife was driving behind us, she was like, what is going on? He was fine. And so I remember she just crumbled to the curb in the ambulance bay. And I just crumbled down and sat there with her, even as at first she was cursing at us, which I can totally understand, right? I've seen that many times in the hospital. That anger has to go somewhere. Of course, it's going to go to the providers. But just sitting there and being with her as she was in this terrible, worst place of her life, trying to figure out that shock of it and not even knowing what to say or to do. I just knew it would be helpful for her not to be alone in that moment. So crumbled next to her on the curb and allowed her to sob into me. So that, I think, is one of the experiences that kind of prepped my work into this. Another experience I remember having was this might have been my very first call actually, was to, what we called it at the time, which is probably not politically correct, was to a meth den. And it was a suburban house in my neighborhood. I had no idea all that was going on there. And so certainly I think that was a time where my naivete was exposed. And as I went on more and more calls, that really got erased and I just became cynical and jaded for a little while. But my partner, we had to go upstairs and my partner fell through the stairs. So they gave way underneath him. So I learned after that, I said, okay, we always let the police go up first. we don't go up first. And so we had to tend to him. And it's also something about self-care, right? Learning that lesson of we have to be safe ourselves. Of course, they taught us that in school, but really recognizing it out in the field. And then we did have to get a crane from heavy rescue to help us to get into the patient who he had been dead for probably 3 days at that point. So there was, nothing that we could do, but we didn't know that going in. And so I think that other lesson of you never know what you're going to find. And I try to bring that into my chaplaincy students, right? We have to be flexible. We have to roll with whatever is coming along because we don't know how a patient is going to respond when you go into that door, much like when you're going out to the scene, you don't know what you're going to find. And so some of the work now I do with our EMTs, but also our dispatchers, actually, I've started working with them as well, because it is, as one of your listeners will know, the secondary trauma or vicarious trauma is what a lot of people call it, second person or vicarious. But I think it's even more so than that, because it's not just that you're hearing about something that's going on, you're involved in it. So for instance, I was talking to one of our dispatchers and they said they hear the terrible stuff that's going on and then they don't feel like they can fully help. And so it doesn't give us that satisfaction or the closing of the loop that we sometimes need in order to know, okay, this did tear up my soul a little bit, but I think I made it better by being there, like my presence or how I was helping impacted the situation enough that it was worth it. And they don't always have that because they don't always see what the outcomes are. We saw this so much during COVID, right? So part of the reason that I got into this work was to be present at death, because I believe that people should be able to have a good death, even if it's in the hospital, even if it is a horrendous situation. If my presence can help even 1%, to me, that is significant and worth it. But during COVID, there were no good deaths in the hospital. It was all awful. The holding up of iPads to say goodbye to the family members. And it was just terrible. And I live in New Jersey. So we were I'm talking the first wave of COVID. And my colleagues who were ALS and BLS were seeing and experiencing the same thing. So I think the first step as supporting providers, and for myself included, is recognizing the impact that this can take on us. And I find a lot of people in healthcare like to live in denial and say, oh, no, this doesn't impact me at all. And there's a fantastic quote, I'll probably butcher it at this moment, by Dr. Naomi Remen, who says, it's impossible to be immersed in the waters of suffering daily and not get wet, right? Like it's just inevitable. This is the water we swim in, the air that we're breathing. And so we are going to be impacted.
Now, you said that you started out in EMS as a teenager?
I did.
You did. It's a pretty profound profession to step into at that age. And I started when I was 27, I think, back in 78. You weren't even born then, I don't think. Anyways, what I wanted to know is that just how profound did you find those first 10 calls, just to give it a number of your trauma calls? I can remember still to this day, a lot of the people who were killed in car accidents or suicide or violence, they're still with you. And I remember my reaction to my first highway trauma. I'm wondering about your experiences, because you carry all this stuff.
Oh, absolutely. And I'm a firm believer of, I really like Bessel van der Kolk's work, The Body Keeps the Score, and a lot of the other trauma practitioners that are talking about, even if we talk about these things and process them, our bodies hold on to them. And there's, I think, a movement toward needing something beyond just talk therapy to process some of this. And I've even done some EMDR myself. That's something I would recommend to people as well, which when I was in social work school was brand new, but now there's been a ton of research on that really helps with PTSD. Because that was a reality for me, was being at some of these gruesome sites and just not knowing how to process them. And we didn't have it. We didn't have a chaplain. We didn't have psychologists or anyone to even normalize it, to say, yeah, this is a lot. And there was very much this culture of you move on. You don't really let it get to you. And yeah, some of the harder ones for me, I struggle with. I'm like, I don't even want to go into too much detail because your listeners may be traumatized by it, but I trust that they'll know how to care for themselves. But I lived in a town that had a train station, train tracks. And unfortunately, we had a number of usually young people that would want to die by suicide on the tracks. Mm-hmm. And then we would get called into that to really do some cleanup and trying to be reverent in the way that we did that. But it was gruesome. And there's things now like I can't watch horror movies or anything that has a lot of physical violence in it. Especially we see a lot of gunshot victims in our trauma bay. And I'm like, no, I can't do it. And my husband knows I can't do any sort of war movie or anything like that because seeing what that does in real life, I have no interest in watching it on the screen. Mm-hmm. So I think from getting involved in that at a young age really sensitized me to what people go through. And it comes out in funny ways now because it's always been in the work that I've done that I forget, this isn't normal for other people to have experienced this much. So for instance, I train chaplain interns and people that are wanting to do this work. So sometimes it's seminary students or sometimes it's clergy who are wanting to become more effective in their spiritual caregiving. And one day I scheduled, it was an orientation week for our new interns or residents. And I scheduled a visit to the morgue because we sometimes have to do morgue visits. So I wanted them to be able to see it before they had to go down there with a family. And I did it right before lunch. And I wasn't thinking. They all went off their lunch. They said, "Oh my gosh, how can you expect us to eat now, Christy?" And I was like, "Oh, I've just grown up with dead bodies. It didn't occur to me that this was something that was..." So now I'm very cautious and careful about when I schedule that. And we have a debriefing session afterwards. So really trying to recognize this is not everyone's experience. It helped me, I think, tremendously to be able to work in healthcare and do the work that I do with death and with education. So I'm grateful for it and I wouldn't change it. But I do have to try to make sure I'm seeking out joy to counterbalance some of the intensity of the experience as well.
Yeah, I'm so curious. Could you just step back? I imagine you're an older teenager.
Mm-hmm.
And I don't know what your childhood was like growing up, but I would think that many of us were somewhat protected. We didn't see a lot of trauma at all, other than maybe cut fingers, stubbed toes, and abrasion on our knees. But those pivotal, life-changing event to show up at a scene like that, and it's your responsibility now to jump in at less than 20, how your age was. We could figure you got to be around 18 at least.
Yeah.
Yeah. And to take that responsibility on. And I can't imagine that it didn't affect you deeply at that time.
I was actually 16 when I first
16.
got
Wow.
licensed and did my training. When I went through it, I was the youngest one in my state to have ever done it because they just changed, I think, the age limits. I do think it was certainly instrumental in terms of what I do now, because I saw the vulnerability that people were going through and really being in touch with a sense of mortality, which especially as a teenager, it's quite easy to feel invincible. But being in situations where it was part of the lived experience, I think one of the ways that it changed me was I just expected the grief or the loss. So for instance, an experience I had 16 years later when I had a series of miscarriages that I went through, about 6 in total. The first one, I remember just thinking, oh, that makes sense. Of course, I was devastated by it, but I also wasn't surprised the way that a lot of my other friends were surprised when they were going through the same thing. They're like, "Oh, I can't believe, I never thought that this could happen to me." I said, "Oh, I never thought it could happen to me. It could not happen to me." So I think it was just seeing suffering all around made me recognize just how universal it is. And for me, it is also paired with my spirituality, because going back to that early belief of feeling that God wanted me to help people, part of what I see as that help is being with people on the worst day of their lives. I sometimes joke with friends of mine who are church ministers, because they say, "I don't know how you could do what you do for a living." I said, "I couldn't do what you do. I couldn't deal with the politics of where we're putting the parking lot or people giving you feedback about the sermons. I can't deal with that. I feel like I can only do the intensity." And to me, that's what matters most. Everything else goes away. It's a bit like some people say they can't do small talk. They can only have really intense conversations. They don't have the patience for the small talk. And yeah, so for me, it's really meaningful to be there with people at the end of their lives or people that are just going through intense spiritual distress, to try to help them to know that they're not alone in it.
Just one more question, and I'll
Sure.
step away from your early years.
It's great. I haven't thought about some of them in years.
Yeah, I found for me, there was a hardening place at the very beginning.
Yes.
That first one, that from my first highway trauma, I was working with an older fella, and I just remember this flush going up my body and down. And I was feeling proud that I can toughen this out. This young lady was dead at the scene. We had to wait for the undertakers to come and recover the body. And the coroner had already pronounced her. So we just had to wait, and we just helped to clean up a little bit. But the next night, we had a party, and I wasn't a drinker at all, but I sure passed my limit. It was so unusual for me to do that. And then throughout those early years, you bounce back and forth through that, from being it was mostly a male-dominant environment at that time. And you emulate all these old pros that have been on here forever, and then something takes place in us that, I don't want to say it's a softening, but it's, I think, as you described it, there's a different kind of perspective takes hold. And you realize that all of us are on a different path. And for me, it sounds a bit like you as well, that what stoked my passion was bringing order to chaos. I felt that was a role that I could play, because at that time, because of all the grief that I experienced beforehand, gave me a sense of control. Because that's how, when you have so much, you don't want anybody to know that you are carrying this grief or this shame around. So it's all about control. And I find that a lot of medics, the good ones, these present that way. And then eventually you get older, and then you have to come to terms with a lot of this, what we see people. We see things that we shouldn't have to see, but somebody, because it's not normal seeing people in this way. But to bring our strengths to that person and their families, and also to not just spiritually, physically, mentally, to be a big help to them is very transformative for us. And that's like my process. And how much do you think that changed you? Because you didn't go into the church right away as a teenager, though.
No. Yeah, thank you for sharing that. I think that's such a profound journey. And I love how you articulate it, this hardening and then a softening. And I definitely learned the hardening when I first started. I joke, that's where I learned all the dirty jokes and all the curse words that you wouldn't expect a Presbyterian minister to know. I learned it from hanging out with folks at the rescue building, and also the gallows humor, right? The ways, yes, very dark humor, which still exists. I still see it all the time in our emergency room in particular. And that's something else that my students really struggle with. They're like, oh, this is terribly irreverent. And so you have to be able to understand where people are coming from, and that this is a coping mechanism. It's a strange one, but it is a way of taking some of the pressure off and really turning that release valve a little bit. Now we want to make sure that families aren't hearing any of this. And so I've had to have some of those conversations when there's family right outside and people are joking in this way. But it's, to me, it's one of the ways that we can keep doing this work, is having to find our own way of processing it, even if it sounds like that. Yeah. And I was involved in the church at the same time that I was doing the EMT work. But when I was in seminary, it was when I stopped, because they make you learn a lot in seminary. So that's when I stopped participating and riding in the backs of ambulances. But now I find that gives me that credentialing when I am talking to our EMTs or our dispatchers, because at first they don't really want to talk to me. And I'm like, oh no, I was an EMT too. And then, oh, okay, then you get it. Then they'll talk to me. Because I think we want to be known, and we don't want this outsider. We want someone that understands what we go through on the regular to be able to talk to us. And I find that true throughout the hospital, actually. We have a terrific EAP program, or employee assistance program, and they'll come in and do debriefs with staff, especially we do a lot of them after some of the intense trauma situations that we have. But oftentimes they call me instead. They say, we don't want EAP. We know you. We want one of our chaplains to lead it. And sometimes I say, I can't. I was in it. I can't do that. Someone else has to come in. But I think that it's certainly a compliment to see the value of bringing in the spiritual component, but also bringing in the familiarity of all being in it together.
Do you have a particular technique or practice that you apply to those who are struggling with loss?
It depends so much on what is the loss, right? And who is the individual. So sometimes it's about identifying what the loss is and naming the loss. So certainly a lot of what we do and what your listeners are familiar with is relationship loss. So it is around the death of the individual. And for people that just lost their loved one, That's a very it's obvious what they are grieving. For some of our practitioners, say, so if I'm working with the nurses or the doctors after there's been a death, they don't have the same relationship to that person as that person's spouse would have. So it's not necessarily the relationship that they're grieving in the same way, but there's other losses that can be brought up for that. So sometimes it's the cumulative loss that we were talking about before. It's like the sheer number of times that they've had to try to resuscitate someone even that week, right? And so that's what's going on for them. Sometimes it's they've just had a loved one in their life die. And so this is going to feel a different way. One that is often very difficult for healthcare staff to process are younger individuals in their 20s and 30s, because it is, I think, a reminder of people's own mortality. And then the other ones that are hard, of course, are children, but really preventable deaths. So things that could have been avoided, such as drownings, such as accidents and things of this nature, because that brings up people's belief in that ordering of the system and the universe that we talked about before. Why is this happening? And really looking at those deep philosophical and theological questions. One patient death can bring about so many different losses for an individual as the healthcare practitioner. So we really start by naming that and acknowledging what's going on.
Christine, how do you support people who has great fear of death?
We explore it. I might say, tell me more about it. What is the fear? And those are conversations I've had a number of times. And so for some people, the fear is not knowing what's going to be on the other side of death. And I wish I knew. I wish I had the answers for people, because they ask me all the time and I don't know. And that's where we explore, okay, what do you think it might be for that particular individual? Another fear that people come up with around death is pain. So they really fear that they're going to be in pain, especially if they know that their death is more imminent. And so that's a conversation that we bring in the medical team on to say, okay, this is a valid fear. How might we acknowledge this for you? I think the biggest fear that I hear expressed is fear of leaving one's family behind. And it's really sadness, right? The sadness that is there and the grief that is there from that individual voicing that. And so being present with them and hearing them talk about it. And then sometimes we will do It is different. And I should have prefaced this by saying there's all different types of death, right? So we've been talking a little bit more about the crisis death, which we do a lot of in the hospital, but there's also death where people know when it's going to be happening or when someone is at the end of their life and they can do a little bit more preparation for that. So not everyone does come to a place of accepting their own death. And I will say the last dynamic that I see a lot of is the patient is ready for death and really accepting of it, especially if it has been a painful journey. And for them, this is going to be a relief, but the family is not. And I understand that. The family, they want to hold on to their loved one for as long as possible. And so I hear and this is sometimes why I try to talk to patients individually without their families present. I'll do both, but I want to make sure that I'm able to get the full story. Because the patient will say to me like, everyone tells me I just have to keep fighting and be strong. And I don't want to do that anymore. Like, I'm ready. I'm done. But they're not listening. And they tell me not to say that and not to think like that. And so then it's really getting to be the person that they say that out loud to, because there's no one else that is going to listen to them because they have different motive, right? The family, of course, is going through their own different griefs.
I have a dear friend who's a retired Anglican priest, and we're talking about death. This is going back a couple of years now. And what surprised me was you said that the members of her church were losing faith in their belief as the time of death neared. What's your thoughts on that?
Yeah, it varies to individuals for sure. I probably hear more of that as a hospital chaplain than their clergy may hear, because I have the anonymity that is attached to me versus their clergy. A lot of times patients will, because I may ask them, have you talked about this with anyone? Especially if I know that they are a congregant somewhere, they'll say no, because I don't want, because they believe it's blasphemous, or they don't want their clergy person to know that they're struggling in this way. Yeah, it's often how I hear it expressed is frustration at unanswered prayer comes across quite a bit. Like I've been praying to get better and it's not happening, which I think then is also frustration at God. So that is probably one of the biggest things I hear in the hospital in general. So it could be at end of life, but it could be really any part of one's journey is anger at God. And a way in which I think it comes out a lot is, especially as it relates to one of my pet peeves as a hospital chaplain, is the use of what I call religious platitudes. So you'll be familiar with these, and I'm sure your listeners will know them. These toxic spirituality, positivity sayings that are not even biblical, but they've made their way into our cultural lexicon. So things like, God needed another angel, or everything happens for a reason, or just let go and let God, or God never gives you more than you can handle. So these things that are meant to inspire people, but really do the opposite. They can cause a lot of spiritual harm. And so I'm usually on the opposite end of that when I'm with people. They've been told these things, like you just have to have faith. And then they said, the faith isn't working for me. Like I'm not getting better. I'm not getting what I want. And so then they believe that their faith isn't strong enough, or they do have this anger at God, because if you're told God never gives you more than he can handle, but then you're given quite a bit, of course you're going to think God's a jerk if that's the case, or really quite evil and maleficent. So I certainly encourage a lot of people that I talk to not to say those things. I think we say them thinking that we're helping, but we're actually doing a lot of harm because they become internalized from when people are given those, and they really silence the experience to what someone is going through.
Okay, so what would be some spiritual practices you could recommend for someone who hectic schedule who struggles to find the time for themselves?
That's a great question. So I'll give you some really specific and simple things to try, knowing that it's not going to be the same for everyone. So some people, a spiritual practice might really work for them. For others, that might not be the one. But one thing I would recommend is you take a 5-minute walk outside, and don't be listening to anything on your phone. Just really trying to, even if you're in a city and there may not be a lot of greenery around you, just noticing the wind on your face or the sun warming you, even the other people that you might encounter walking by, just trying to take 5 minutes and say, I'm just going to go for a walk and see what happens. Even if you're walking to your car from the grocery store parking lots, doing so to be able to just take a deep breath as you're going in and having some mindfulness in that moment. Another practice that I think can be helpful for people is a version of a gratitude practice. And they have apps for this if people are interested in that sort of thing, but you can just do it by writing something down or writing something in your phone. I've gone through periods where I like to write down either 1 or 3 small things that you're grateful for that day. And I'm not talking about the big things like, oh, my health, my family, my house. All those are well and good, and it's helpful to have that. But I'm looking for micro gratitudes. What are the very small things that you are grateful for in that moment? Because that can really shift our mindset. So it may be something as simple as, today I am grateful that I got to work on time when I'm usually sitting in traffic. Or I'm grateful that this conversation with a coworker went better than I thought it was going to go. Or I'm grateful that that bill that came in the mail was a little bit lower than what I thought it would be. Very granular. I'm grateful for how nutty my granola tasted when I made it. Really looking for small things, and because that is the art of noticing. And when we are grateful for the small things, that can help us to be grateful for the larger things too. And I'm not talking about gratitude at the exclusion of the suffering, because I'm not saying focus on only the good. I'm saying, no, even in the suffering, there can be small things that you're grateful for. And so really trying to hold those two in tension.
Thank you for joining us on this episode with Christine Wasco. We hope her journey from EMT to chaplain has inspired you and provided new perspectives on navigating trauma, PTSD, and the power of compassionate healing. Christine's story is a testament to the strength of the human spirit and the profound impact of empathy and connection in the face of suffering. If you found value in today's episode, please share it with others who might benefit from Christine's insight. And don't forget to subscribe to our podcasts. Until next time, remember to take care of yourselves and each other, finding moments of mindfulness and compassion in your everyday lives. Thank you for listening.